Bonjour et merci.
Hello, and thank you for joining us today.
We'll hear from le ministre des Transports, Marc Garneau, sur la vidéoconférence, et le président.
Today we'll hear from Marc Garneau, Minister of Transport, and Jean-Yves Duclos.
Merci, Christia.
Thank you, Christia. Hello, everyone. The COVID-19 pandemic created a global pandemic without precedent and has impacted transport, travelers, and our economy. The Canadian government is determined to protect Canadians and to ensure that air travel is not a way to spread the virus.
My highest priority is the safety and security of Canadians and the transportation system. That's why, since the beginning of the pandemic, we began introducing a range of measures to reduce the risk of the spread of COVID-19. These include mandating face coverings for travelers and transportation workers, conducting health checks for those who must travel, and publishing health guidance for the air industry. Today, I am pleased to announce another layer of protection to our approach. Starting later this month, air operators will be required to conduct temperature screenings at the point of departure for all passengers on international flights entering Canada. This will apply regardless of the passenger's point of origin. This measure is in addition to the existing health check questions for symptoms and helps ensure that no passenger travels to Canada with an elevated temperature. By the end of July, the Canadian Air Transport Security Authority, or CATSA, will become responsible for temperature screening as part of the departure procedures for domestic, transporter, and international flights. Airport and aviation personnel will also have their temperature checked by CATSA before entering airports to help maintain a healthy and safe place for travelers and workers alike. À partir de la fin juin, les exploitants
Starting at the end of June, air operators will have to do a screening of temperature for all travelers, international travelers to Canada before boarding, before the departure. This is to be implemented regardless of the point of origin. By July, the Canadian Air Transport Security Authority, or CATSA, will be responsible for screening the temperatures of passengers, and this is part of screening measures for national and international travel. CATSA will also be checking staff temperature before they access the regulated areas of airports in order to ensure that the space is safe and secure for workers and travelers.
This is in addition to the health screening questions and the wearing of face coverings that are already required. By the end of July, we are aiming to have temperature screening stations set up in the departure section of Canada's 4 largest airports that are currently accepting international passengers. By the end of September, temperature screening stations will be placed in the departure sections of the next 11 busiest airports in Canada. All passengers who have an elevated temperature confirmed after a second reading will not be permitted to continue their travel and will be asked to rebook after 14 days. La vérification obligatoire de la température est une autre.
The mandatory screening of temperature is another measure that will be put in place by the government in order to protect the safety of travelers and workers in air transport. These measures will ensure that no passenger going to Canada or leaving Canada, same for domestic flights, this will ensure that they do not pose a risk to other travelers. As always, we will be doing a follow-up of these measures and we will expand them if needed. To conclude, I would like to thank travelers and workers throughout the country who are contributing to the safety of Canadians of Canada by following all COVID-19 measures. Thank you.
Merci, Marc.
Thank you, Marc. And now I will give the floor to Jean-Yves Duclos. Thank you, Marc.
Several important announcements this morning. I will focus on one. C'est celui du renouvellement de la présence des forces.
I will focus on the Canadian Armed Forces being in long-term care facilities until June 26th. Two main messages. The government has always said that it would be there to take care of seniors. Second main message is that nothing has changed over the past few weeks. Of the 1,400 Armed Forces members who are on site in Quebec, they will continue to be there. They are today, and they will be there until June 26th. Other good news is that the Prime Minister is committed to helping until September 15th, as was requested by Quebec. Additional forces from the Canadian Red Cross, so volunteer, they will send people who will be well-trained and well-paid to give additional support. This is great news because in the coming months, that means that the Canadian government and the Quebec government will have more staff that will be well-paid and well-trained. And so these people will be able to assist. So this is great news that allows us to continue to collaborate with the government of Quebec. Thank you, Jean-Yves. And we are now ready to answer your questions. Thank you, Deputy Prime Minister.
Phone, one question, one follow-up, and then we'll turn to the room. Operator, over to you.
Thank you. Please press star one at this time if you have a question. Appuyez sur l'étoile maintenant si vous avez une question. Notre première question est de Raymond Fignon de TVA. À vous la parole. Please go ahead.
First question from TVA. Happy Friday. I have a question for Minister Garneau regarding fever detectors, if we can call them that. Who is going to pay for this equipment? Will there also be additional staff sent in to assist? Answer. Thank you, Raymond, for the question. The costs are quite modest, but we don't know them because CATSA will be responsible for the purchasing of equipment for this to be deployed in 15 airports, as I mentioned. There's a choice of different tools that can be used, and they need to be precise enough. CATSA will be able to pay for these with its budget. Follow-up question. What made you change your mind? Because a few weeks ago, you were saying that it wasn't effective. Ottawa seemed to snub this technology. What changed your mind? Answer. I would like to tell you first and foremost that I'm an engineer. I believe in science, and I can tell you that there's a high probability that if somebody has COVID-19, if they have a fever, and if they try to fly, we will be able to detect it. There are two international organizations in aviation, and they recommend temperature screening. Air Canada and WestJet have already put in place measures. Other countries have put in place either the same program or are thinking about it. We also need to remember that a lot of information is based on SARS, which occurred in 2003, if I remember correctly. That pandemic only affected a small number of people, whereas today we are facing a virus that has already infected millions of people in almost all countries in the world. The question, thus, is not the same. The situation is not the same, and we believe that temperature screenings are a great way to add a layer to our security measures, our safety measures, and we will be able to ensure that there will not be a spread of the virus through our flights. Can you repeat in English?
I do believe in science, and I can tell you that if somebody has COVID-19 and has a temperature and wants to take a flight, the chances with temperature measurements are very high that we will detect that person. Is it perfect? No. But it is part of a layered approach that we are taking. And we are also going along with IATA, the International Airport Agency, and the ICAO, the International Civil Aviation Organization. These are world bodies that recommend that it be done. Many countries have done it or are contemplating it. Country, Air Canada and WestJet have put these measures in place. And I would also say the temperature measurements, they often refer to the SARS situation. That is a situation that involved very small numbers. We're talking here now about millions of people in virtually every country, over 200 countries. And I will repeat that it is part of a layered approach. And if a person does have a fever and has SARS, the coronavirus, there are very high probabilities we will detect that. And that way we can protect Canadians from the spread of this virus.
Thank you, Minister. Operator, next question, please.
Thank you. Our next question is from Teresa Wright from the Canadian Press. Please go ahead. À vous la parole.
Yes, thank you. My first question is for Minister Garneau. Iran's representative to the International Civil Aviation Organization said this week Iran is going to give the black boxes from Flight PS752 to France instead of Ukraine, and that this will happen as soon as everyone who needs to be there can travel. Does Canada have any evidence that Iran has made the offer? Do you have any expectation they will follow through this time? And does Canada think it's okay for them to send the black boxes to France and bypass Ukraine?
First of all, we think it is perfectly acceptable. In fact, it's a good idea to send those black boxes to France, and that's why I was speaking at the Council of the ICAO earlier this week. It has been 92 days since Iran promised that within 2 weeks it would move the boxes. We know that the BEA, which is an agency in France, like our Transportation Safety Board, has the capability and the expertise to analyze these boxes, and we are strongly encouraging Iran to move those boxes to Paris as quickly as possible.
Follow up.
Yes, thank you. My next question is for Minister Freeland. Reports that Canada and the U.S. will likely agree to a clean rollover of the border restrictions into July have come as a disappointment to many, including divided families and border communities that depend on tourism dollars. And they want to hear less about whether the border and more about how it will open when the time comes. So when will Canadians and Americans start hearing more about how the border will open instead of whether it will?
Well, look, first of all, let me simply say that when it comes to the collaborative approach on the border between Canada and the United States, we are having ongoing, constant conversations with our American partners. I think that it's important for all of us to recognize that so far, our joint collaborative approach to the Canada-U.S. border has been a real success. On one hand, we have allowed essential travel to continue, travel which is so important for our economy, so important for the medical supply chain, and that has really kept on going even at the height of this pandemic here in Canada. And at the same time, we've done the most important place. We have been able to protect Canadians and act in a neighborly way towards our American partners. When it comes to decisions about the border future, let me first of all emphasize that all decisions about the Canadian border will be taken by Canadians in the Canadian national interest. Of course, we understand that Canada is an open society. We're an open country. We are used to traveling freely, and that is a great thing about our country. I think we all also understand that we are living in truly exceptional circumstances when people across our country have made great personal sacrifices to fight this pandemic. People have stayed home. They have endured tremendous restrictions. And let me point out also that travel within Canada between provinces and territories continues to be restricted in many places. I think all of us are really excited about the gradual reopening of our economy. I think it's a relief, but at the same time, I think it's very, very important for all of us to appreciate how serious this situation is and for all of us to act prudently and carefully. For me, it is such a priority for us not to squander the gains that we have made at great price, a price paid by every single Canadian and paid particularly by people working on the front lines of healthcare, people working at the front lines of our long-term care facilities. So our government's approach is going to be careful, it's going to be cautious, it's going to be prudent. And I'll just conclude by saying we had a discussion with the first ministers, the premiers of the provinces and territories about this really important issue yesterday evening.
Merci, Madame la Vice-Première ministre. Opératrice, prochaine question, s'il vous plaît.
Thank you. Notre prochaine question est de Philippe Vincent Foisier de Radio-Canada. À vous la parole. Please go ahead.
Oui, bon.
Question from Radio-Canada. I have a question, Madam Freeland, regarding the borders. If we're screening for temperatures, does that mean that the borders will be open? And regarding temperature screening, is this a scientific decision? Because we don't know what Ms. Tam believes. Answer. As Mr. Morneau explained and as the Prime Minister explained this morning, our approach is to put in place lots of measures. We want to put measures together so that we can protect the health of Canadians. Measures individually cannot guarantee the safety of Canadians. However, by taking a group of measures together, like masks, for example, like temperature screening, like quarantine, like social distancing, by doing all of these things, we are able to guarantee the safety of Canadians, and that is our priority. Mr. Garneau? I would like to add that Madam Freeland responded so well to this question. Thank you, Mark. Regarding the measures mentioned this morning, this is for air passengers. This is a border that is extremely important, and it's for air passengers currently. A follow-up question? So this doesn't mean anything regarding non-essential travel. I have a question for Monsieur Duclos. Regarding the Canadian Armed Forces, you said that there are 1,400 members, and we hear that there are about 350 in supervision, about 300 in long-term care facilities. Quebec has requested that they stay until September. Is Quebec being unreasonable? Why don't you want to answer the question? Why is it so complicated to find a solution with Quebec? Answer. Mr. Sajan, Madam Freeland, discuss on a daily basis with our Quebec counterparts, and this is important. Maybe a reminder of the important numbers. For the past few weeks, there's been 1,500 military personnel deployed. Some of them are there for support to those who have medical training, or they are supporting in these long-term care facilities, supporting those who have medical training. June 12th, there are still 1,500 members deployed on site, but where they are and the number of them depends on the different facilities. Directives have been changing over the past few weeks because some long-term care facilities that were in the red are now in the green. So personnel doesn't need to be there anymore. So 25 of these long-term care facilities that had been identified and prioritized by the government of Quebec no longer are a part of the list of those who need all that help. 35 long-term care facilities were assisted at some time by the Canadian Armed Forces over the past few weeks. Regarding dates now, we have announced measures 1,350 Canadian Armed Forces personnel that will be in the field, that will be placed according to the needs of Quebec and long-term care facilities. So Quebec determines when and where they need to be deployed. Another important date, September 15th. Mr. Trudeau stated this morning that the Canadian government would be supporting seniors up until September 15th and perhaps beyond September 15th. That's what he said this morning. And he also said that we are looking for additional support with the Red Cross. And this is great news because it adds to staff that is trained and well paid. It adds assistance to the Canadian Armed Forces, and it offers assistance so that Quebec can train its own personnel, its own staff. That way, if there's a second wave, things will be even more effective. Because beforehand, the Canadian Red Cross forces were not available. Now to the room.
For taking our questions. My questions are for Minister Garneau. Yesterday, the CEO of Air Canada called the Canadian government's measures on travel disproportionate and asked to be able to allow for some type of reasonable business to pursue. I'm wondering what your response to those remarks are. And also, is there a risk with these new temperature checks that people will be even more unlikely to travel and fly?
Well, thank you, Kelsey, for your question. The second part of your question, no, I think with respect to taking temperatures, I think Canadians and international passengers will welcome these and realize that these are an additional layer of safety for Canadians. With respect to the statements from Air Canada, look, I understand they're a business. They would like to fly, and they've been hard hit by this pandemic with respect to their revenues and the number of flights. At the same time, this government has an overriding priority to ensure the safety of Canadians, and that passes through the measures that we have to put in place in the country to make sure that we are going to minimize the possibility of it spreading. And that also includes air travel. And so I'm sure that Air Canada understands this. In fact, Air Canada has been working very constructively with us to implement some of the measures that we've put in place.
And just as a follow-up, you had mentioned that if a passenger has a fever, they're going to be asked to rebook in 14 days. Am I to take that as passengers who have fevers and are denied to fly are not going to get a refund for that flight?
The process at the moment is that we want to make sure that if a person has a fever, and there will be two measurements, 10 minutes apart, that they rebook. We don't want them to enter the secure area and take the flight, and they will be given the opportunity to rebook their flight 14 days later. We will work with the airlines as this program is deployed to see if we can do the maximum possible in the interests of the passengers, realizing that it's in our interest as well as the airline's interest not to allow somebody to take a flight if they have a temperature.
Thank you, Minister. Mackenzie.
Hi, Ms. Freeland. Mackenzie Gray from CTV News. One thing that governments across the country and many Canadians have agreed on is that frontline workers have worked really hard, many of them for a very limited pay during this period. That's why a number of companies, including Loblaws and Metro, gave a $2 raise to their frontline employees, the cashiers and such. Loblaw's put out their first quarter statements. They made almost $250 million, which is up substantially from last quarter. But coming this Saturday, they are reducing the $2 kind of pandemic pay that is being given to the frontline workers. What's your reaction to that, considering that it's very clear that the virus is still present and that many of these workers, many who are racialized and low-income Canadians, have been relying on that money to get through this period of time?
Thanks for the question, Mackenzie. And let me start out by saying how grateful I am personally, how grateful I think all Canadians are and should be to the frontline workers who have made it possible for us to get through this pandemic so far, working in risky and difficult situations. And I think, as you say, Mackenzie, one of the things I think we've realized is many of the people doing the truly most essential jobs in our country are among the people who receive the lowest pay. I think that's something we all need to think about. I would urge all employers to be generous with their frontline workers, to recognize the extraordinary job they're doing, and to recognize the fact that Canadians really, really appreciate it. Our government has been working with the provinces to provide a top-up for essential workers, and that is a recognition by us of how important the work they do is, and of the fact that many of them, as you say, Mackenzie, don't earn very much money.
Moving over to the video of Chief Alan Adam, the RCMP said that there was a reasonable use of force. I have yet to find anyone who's watched that video and thought that that was a reasonable use of force against the chief. What does that say about the RCMP and their culture that they think it was reasonable to do that? And what is your analysis of that video?
You know, let me start by saying, I think for me and for all Canadians, those images are incredibly disturbing. And it's right for us to be really disturbed by them. This is a moment in our country when we need to confront the really horrible reality that systemic racism exists here in Canada. Anti-Black racism exists here in Canada. Anti-Indigenous racism exists here in Canada. It is systemic. It exists in all of our institutions, including the police. And we need to acknowledge that. We need to confront that. And we need to work really hard together to end that. In the conversation with the First Ministers last night, the Prime Minister raised the issue of racism in Canada and how we need to do much, much better, including when it comes to policing. When it comes to the treatment of Chief Adams specifically, an independent investigation is happening. That is absolutely essential. And I think that all Canadians will be following that investigation very, very carefully. Our government will certainly be watching it very, very carefully.
Thank you, Deputy Prime Minister. Mike?
Michael Couture from Global National. This is a question for Minister Garneau. Early on, when flights were still coming back into Canada, your government was asked why not screen people with temperature screenings, and at the time, a variety of answers were given, such as, that we just didn't have the staff to put there. I'm just trying to figure out, now you're fully in favor of it, and you're saying that you're anchoring this on science. I don't think the science changed in the last 3 months, so I'm trying to wonder why your government has decided to change its view on temperature screenings at airports now.
Thank you for the question. As Deputy Prime Minister Freeland and as the Prime Minister and as I have said, we have decided that we should take a layered approach which involves a number of factors. For example, we made it compulsory for passengers to wear masks during the flight, and when they could not maintain distance, they have to answer a screening questionnaire. They are now going to have their temperatures tested. We feel that this layered approach maximizes the possibility of us detecting somebody who might have COVID-19 and who, of course, might infect others. So we think that this is the right approach to take, this layered approach that maximizes our potential and our probability of detecting somebody who may have the virus.
I can appreciate that. With all due respect, that wasn't my question. It was, why did you change your mind in deciding to now use temperature checks as opposed to a couple of months ago when that was not the case?
So I will add to that the fact that IATA and ICAO, two world bodies representing all of aviation, as well as countries like South Korea, India, China, other European countries, Canada itself, with Air Canada and WestJet making the decision of taking temperatures. We have looked at the evolving situation and decided that it is a safe and prudent thing to add this as an additional measure at this time, because if somebody does have COVID-19 and has a temperature and wants to take a flight, the probability is very high that we will detect that person and minimize the possibility of spread.
Thank you, Minister. We'll now go back to the phone for 3 questions. Operator.
Thank you. La prochaine question est de Lina Dib de la presse canadienne. À vous la parole. Please go ahead.
Oui, bonjour. Question from La Presse Canadienne. Mr. Garneau, my question is for you again. It has to do with temperature screening. I want to understand. Our international borders are still closed as far as I know. Can you explain to me why you're talking about temperature screening of people arriving from abroad, and you talked about July with temperature screening of travelers inside Canada? I don't understand. Answer. We need to have a phased approach because it can take time to get the equipment needed, and what motivates us is the fact that our borders might cause the spread of the virus from passengers from abroad, where we have a limited possibility of screening. People can come from different countries, so we want to limit the possibility of the spread of the virus. That's one thing. Secondly, we are all concerned by the possibility that the virus would come back, that there would be another wave, and that's why we want to take all the measures that we can. There are restrictions with the different provinces, and we want to put measures in place for domestic flights. Lena, before moving on to your follow-up question, Mr. Garneau, could you repeat your answer in English?
We have decided, as I mentioned, to put in place temperature measurements. First, for international passengers coming into the country, we can put those measures in place quickly. It means that foreign airlines at the point of departure to come to Canada will take temperature measurements. Many of them are already doing it before they come into the country. We have less control over what is happening in other countries, and therefore we want to make sure we minimize the possibility of introducing the virus into Canada by air passengers. So that's as a first measure. And secondly, we also want to make sure that we minimize the possibility of spreading it within the country, because passengers do fly from one place to another across the country, and it will take a little bit longer for us to purchase the equipment, set up the procedures so that we can temperature screen people when they're taking domestic flights.
Merci. Lina, en suivi?
Lena, your follow-up question. Yes, thank you. Moving on to Monsieur Duclos regarding Canadian Armed Forces. You said that there are 1,350 deployed in Quebec. I think Mr. Legault knows how to count, and he said that only 400 are working in these long-term care facilities. Why are you fighting on this number? Are you saying that there are 900 others that are there that aren't working? And also, why is it taking so much time to replace these soldiers by Red Cross members? Can you explain why? Answer. The main answer is that from the beginning, we have said that the Government of Canada would be there for as long as Quebec said that they needed assistance in these long-term care facilities in Quebec. Today and until June 26th, 1,350 Canadian Armed members will be equipped to intervene in long-term care facilities. The way these members are deployed depends on the directives and the needs of long-term care facilities. Over the past few weeks, there was a significant improvement in most of these long-term care facilities. That's why, even if members were deployed in only 25 facilities, they actually acted in about 35, and they will be deployed in other centers, other facilities, up until June 26th. Furthermore, we will be continuing this collaboration and this intervention by the Canadian Armed Forces, and Prime Minister Trudeau announced that up till September 15th, the Canadian government will continue to support seniors in Quebec. This includes resources that have not been used, resources by the Red Cross. These people will be well trained and well paid to work in these facilities, because we know in Quebec an issue is the availability of human resources. The Canadian government has committed to assisting and has deployed Canadian Armed Forces in the past few weeks to offer assistance. Thank you, Mr. Minister. Next question, please.
Our next question is from Brett Forrester from APTN National News. Please go ahead. À vous la parole.
Hello, Deputy Prime Minister. Indigenous people in the action lawsuit alleging widespread police brutality and systemic discrimination by RCMP in the three territories. Given what you just said on that topic, do you think the RCMP should negotiate a settlement in that case?
Thank you for the important question. I'm not going to comment on a case which is before the courts right now. But let me be clear, as the Prime Minister has been, that our government understands that systemic discrimination exists in Canada. Systemic racism exists in Canada in all of our institutions, including the police. That's something that we need to acknowledge, we need to confront, and we need to work to end.
Thank you. Thank you for that response. The other day in the House, you referred to the need for root and branch reform when it comes to policing, especially in Indigenous communities. Can you explain what that means and how the government can make police more accountable to the Indigenous communities they are supposed to protect and serve?
Thank you again for the really important question. I'm sure you would agree with me that we could all spend the rest of today and probably the rest of this month talking about it. It's a big, challenging issue. And to offer a short reply to a very big question, I think the place to start is for the government to listen to Indigenous people in Canada.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you. Our next question is from Hélène Buzetti du Devoir. Please go ahead, à vous la parole.
Oui, bonjour,
Question from Le Devoir. My question is for Minister Garneau. A technical question. Can you give us the exact date? You talked about end of June for the implementation of temperature screening. And if I understood correctly, if our temperature is too high, we are going to be asked to rebook in 14 days. Is that not a long time? Sometimes we have a small fever. It doesn't mean that we have a virus. And you weren't clear. If you have to take another flight later on, do you have to pay fees or will it be included in your ticket? Answer. Thank you, Hélène, for your questions. To explain the dates, the implementation of temperature screening for flights to Canada, so for international flights, that would be at the end of June. We're hoping that by the end of July, these measures would be implemented in the 4 largest airports for domestic flights going to other countries, and by September, the end of September, for the other 11 airports. So those are the dates. If somebody has a high temperature, we are going to verify their temperature twice with 10 minutes between. And if the person still has a high temperature, they will have to wait 14 days before booking another flight. And we're working with airlines in order to make sure that there are no penalties in the price that people would have to pay for rebooking a flight. Hélène, just a moment, please.
Very good. So with respect to the dates to temperature testing into place, for international passengers coming to Canada, that would be at the end of June. For domestic passengers, it would be at the end of July in our 4 largest airports. That is for domestic flights or flights leaving the country, but from those 4 largest airports, end of July. And for the 11 next largest airports, it would be the end of September. If a person has an elevated temperature measurement, and we would do 2 measurements 10 minutes apart, just in case the person, let's say, was running very vigorously to catch their flight and there was a temporary elevation in their temperature, we would take the temperatures 10 minutes apart. If the person still had an elevated temperature, we would require them not to rebook for 14 days. That's an arbitrary but prudent amount of time. The intention is that, and we're working with the airlines, is that the rebooking would not be more expensive. It would just be a rebooking to a different date.
Alors, Monsieur Garneau.
Follow-up question. So, Mr. Garneau, I understood the end of June. I was just wondering if there was a more specific date, but clearly there isn't. My follow-up question is to ask whether or not this applies for Canadians abroad who would like to come back to Canada. Would they also be banned from flying if they have an elevated temperature? They're Canadians. If they want to come home, if we make them wait 2 more weeks abroad, will there be some kind of compensation? Because one can imagine that they'll have to book hotels, that there will be more fees or more that they'll have to pay because of this. Answer. I think that we all agree if somebody has COVID-19, we don't want to take the risk of this person taking a flight, whether this person is Canadian or not. Right now, the intention is that if somebody has an elevated temperature, we're going to ask this person to rebook 14 days later. Currently, there aren't any other measures. We would like for the rebooking fee to be the same 14 days later. One last question.
New Minister Garneau, Ashley Burke, CBC News. Privacy experts have warned that it could be a breach of privacy laws here in Canada if people are asked to have their temperature taken, if it's unnecessary and not evidence-based. Have airlines asked you to make this mandatory so it's required so they do not come across privacy issues later on with the Privacy Commissioner?
So thank you, Ashley, for the question. And we ourselves, of course, look at these matters before we make decisions. And in this particular case, we're talking about a national safety measure to protect Canadians. And we feel that, based on all of the expert advice that we have, that this is a very reasonable measure to put in place to ensure the Canadians are protected.
But have airlines asked you to make this mandatory? And also, Minister Freeland, there are reports that Americans are showing up in Banff without self-isolating for 14 days, that they're telling border officials that they're on their way to Alaska, which is allowed, but then they're staying there for non-essential reasons, for vacation, perhaps, and they're not quarantining for 14 days. Can you also respond to that and tell us what you're doing?
Yeah, go ahead, Mark, if you want to add anything.
Okay, so there are a number of measures in place, including quarantine, and we expect people to follow those rules, and we do spot checking on them. There will be cases where people do not do it, and we believe that that's an irresponsible thing to do. We're largely satisfied that most people follow the requirements that are put in place. We cannot guarantee 100% that everybody is going to do it, and we are to some extent assuming good faith on the part of people at this point in time.
Yeah, and I'll just add, when it comes to the Canada-US border, I do want to emphasize that the reciprocal arrangement that we have with our American neighbors is working really well. Overall, we have managed to simultaneously restrict non-essential travel, and there is much, much less travel than at normal times, and to still have the absolutely essential travel that our economy depends on, that our medical supply chain depends on, to have that travel continue. One of the things that both Canadians and Americans need, some of us, is to be able to travel through each other's countries as part of our regular lives. I think we are familiar with people in Campobello, for example, Canadians who need to travel through the U.S. just as part of their daily existence. And likewise, some Americans need to travel through Canada as part of their, to get to another part of the United States. Having said that, border guards do a great job and ask questions to determine whether these journeys that people are making are for essential travel or not. And I would just like to emphasize to all Canadians, to all Americans, that these restrictions are there for a reason. They are there to keep us all safe. Please do not come to Canada unless you are coming for an essential reason. And I want to thank our border guards for doing a really, really good job. It's really hard. I have been really positively impressed by the extent to which our border guards have successfully managed to restrict the non-essential travel and keep the essential travel going. Thank you.
Thank you, Deputy Prime Minister. Ceci met fin à la conférence de presse pour aujourd'hui.
This concludes today's press conference. Thank you.